Thank you very much, Dr. Dini. I think basically there's a lot of excitement because of the willingness to showcase what we have done here in Mayapada. So again, I would like to thank actually Anders for the introduction. And I mean the big portion of the thank actually goes to the team who has been actually pushing this on the ground and making it to work. Not forgetting the support of this platform who has been there. So with that, I would like to start off first. Allow me to share my screen. Yeah. Okay, okay. As I've shared earlier, it's a privilege to be here. I'm Rajpal, a part of Mayapada Healthcare Group. Okay, we are dialing in actually from Jakarta, Indonesia, and basically, we would like to share our journey on what matter to you. Yeah. So, little bit of outcome, a little bit of sharing, basically on our country, basically about Indonesia, which is a few points actually just to put the setting on the podium. Okay, it's basically Indonesia actually a part of geographic marvel. It is an archipelago of more than 17,000 islands. So it's actually one of the biggest country in the world. Okay, varied by landscape and pristine beaches as well. It's a joint of cultural tapestry. There is multiple culture. You have people from a different race background, ethnic background, who actually live here and call this place home. It's a friendly heaven, so that's why. But most of the time, we are only known for being the big durian in Jakarta and Bali being the tourist destination. But Indonesia is more to that actually. It has a spectrum of different colorful lights and people coming from all around. So basically, this year forward, I mean, these past few years, there have been a modern vision. There's been a rapid urbanization. I mean, the economy is growing. Same time, the healthcare industry in Indonesia is also thriving as well. So with that, actually, it brings into perspective our program very much into place. Same time, has sustainability pledge has also been in place to basically embrace eco-tourism and green initiative, and same time commitment to environment conservation. So, Mayapada Healthcare Group. Okay, just give me a while. Team, I need it to be mute. Please put your thing on mute, please. Appreciate it. Tolong mute kan ya.
Ibu Siska. Mbak Tristi bisa di-mute dulu, Mbak Tristi.
I think Siska, is it? Yeah, okay, great. Okay, there was a little bit of advertisement there. Okay, so Mayapada Healthcare Group stands as a premier international accredited healthcare organization in Indonesia. So basically, we distinguish ourselves with international standard hospital commitment to deliver exceptional services. And currently, basically, our group actually has hospitals operation in Java Island, and the group is actually poised for substantial growth and planning for the next few years to grow in new locations. So currently, has shown here is actually this Java Island. We have 6 hospitals in place here. Yeah, and more than 1,000 beds actually in place. Yep. So basically, what matters to you? Okay. Basically, the reason to choose this program was to enhance communication, to build a trusting foundation between our patients or customers with us, the healthcare workers, to establish a personalized care platform, to give a perfect outcome. I mean, quality and personalized care, to empower our patients and also customers so they are the part of their care that's given, and also to be similarly cultural sensitivities to be in sight when care is given. And finally, to ensure that the organization shift dynamically towards progress. So we noticed that what method to you program, it actually correlates with all these outcomes that we wish to aspire. And the main thing is actually because the voice of our customers or our patients does matter in this option. So how we have done it actually? So it all started in April 2023. We actually had a kickoff meeting. So what happened is during this session, we actually look into the methodology and engagement and to anchor all the healthcare workers, particularly anchoring the nurses. As we know, the nurses are the backbone of any healthcare facility. So with anchoring them, we were very sure that we can get this program moving. So we had a pilot then started also in April in one or two departments in 2023. And we noticed that it was actually quite, it brought positive results with the trial. So we tested the system, how we wanted this program to run, and also the materials to put in place. So in May 2023, all our inpatient areas, we actually rolled out this platform or What Matter to You project. We had standardization across our 6 entities, the 6 hospitals, and we continuously engaged the team. And in September 2023, actually, we held a competition among the hospital on What Matter to You to see how we can progress better and engage the team. And the main initiative, like I pointed out there, is actually to engage and motivate the team, but same time to also to share outcomes, because we wanted the healthcare workers or the nurses in place to also have a say in it, and so that they feel engaged with the program. Because we noticed that many times, many programs, it doesn't work when the team does not feel engaged or empowered to do it together. In September 2023, we had a session. We actually rolled out a Google review form to basically gather feedback from our partners, which is the nurses on the floor. And this is basically again done is actually to gather feedback, to run through the PDCA cycle, and also to share outcomes, so that we want it to continuously positively grow rather than the whole project move on a regress motion. And similarly, a staff feedback was done in February 2024 to study the same motion at the same platform. And with that, actually, the main thing is actually to actually share with the healthcare workers, particularly the nurses, that What Matter to You program, how can benefit all of us, including our patients. Okay, how basically did we do it was actually, we have the healthcare personnel, the doctor and the nurses, having the What Matter to You assessment during patient admission. So basically, it falls back to the same principles that was shared on patient centricity, which is to ask, listen, and do, that make the conversation count. So this is actually done in both verbal and non-verbal intonation. That means basically when they are being questioned, they ask the patients or how it's being asked by the doctor and nurses. Same time, verbally and non-verbally, the feedback is gathered. And based on that, the identification of care is rolled out, is made accordingly. And from that onwards, a care plan is actually derived. And this is then communicated so that we know that the care is actually provided 24/7. So communication is the key to it. So the team actually does better together when it's communicated. So we have a whiteboard in place, our nursing care plan, and handover, which is linked back together with this care plan that is derived from the assessment. So like I shared, the whiteboard or the board is actually one of the mode that how this thing is communicated. The example is something like this. We have in multiple varied enograms or graphics. This is actually designed by the nurses themselves because we want them to feel empowered and engaged so that this project can be pushed forward. So every day when they get a feedback, a particular bed or a particular patient, they update it. And this is actually shared 24/7 on every shift handover. And like I shared, the graphic is actually decided by them so that it actually empowers them to be a part of the whole project. I have the last one here. A picture is actually one of the hospital director of nursing who is a part of the program. She's actually showcasing that the pediatric ward had a tree. It's actually a synonym with the metaphor of growth. So the tree is used there. So you can see a happy face there. Yeah. So same time, we noticed that since we want to do this program, doing it from our part, we have to gather feedback to make sure that it's working well. So we had this QR code derived to basically, after the patient's care is rendered, when the patient is on the way to home, I mean, when the care process is planned at the discharge stage, we can basically, yeah, sorry, can we just put it mute, please? Thank you. So basically, at this point, we can get feedback from them when they are on the way of discharging or going back home. So we had this QR code in place. So at this QR code is basically once a person scans it, it has three main elements that is being measured, which is the treatment plan, the experience, and relationship. And we actually chosen these three elements is because to give us an overview of the program, how the patient sees it. Okay. And the total engagement out of the QR code that we got from the patient is actually from the three element relationship, treatment plan, and experience. I'm happy to share here that it has been on a sliding or exponential growth scale. And actually, the total feedback received was 94% or a sample of 2,800 for March 2024. So it's been growing ever since. I know that it will be a challenge to reach 100%, but for us, 90% mark and above is actually the target that we are looking forward to. And we have actually achieved that, and we would like to maintain that. Yeah. So this QR results at these three elements was also rated based on the QR. And based on that, actually, at the March results, the treatment plan was rated at 83%, experience was 89%, and relationship 82%. I think it's synonym with the foundation of what matter to you project. I would say that it actually improves experience and overall the treatment plan and also the relationship as well of the sample. So this percentage from beginning of this year has been hovering above 80%, which shows a good number. And the same thing also, we like to maintain it as such. So the next thing comes in place that, okay, we know that we are doing it, the patients are benefiting it, they feel happy, they're giving the feedback through QR, but basically how do our team feel about it comes into question. So we have actually had session where we ask our team member how they feel. So this is one of the nurse from one of the hospital in one of our hospitals. She shared a keyword that says trusting relationship can be built. Another nurse from another hospital shared that it made easier for her to provide nursing care for the others, especially for the patients. We have another nurse. She shared that the needs and interests of the patient becomes a priority. So she was happy to share. And another nurse shared that the cooperativeness of the family member with the patient is achieved easily with this project. So these were positive feedbacks from our staffs as well on the ground. So just to anchor it and make sure that it moves smoothly forward, we also had a staff feedback Google form that is derived, which we got the information twice, which like I shared September last year and February this year. So based on the February data, basically some of the parameters, when we sum up, they all believe that the patient care change. 5 to 10 rating, which is the higher range, more than 80% agreed that it changed to the betterment. Improvement relationship also improve as well, more than 90% agreed on that, on the higher rating. And they learned something new, which is 98% believe such. And same time, we also had a free text mode at below of the form, telling them that what the most they benefited out from the program. And based on the February feedback, they more than 70% actually rated understanding of the patients has actually increased tremendously. This is from the nurses directly. So with this, actually, we summed up that the nurses were very happy with this whole program, and their feedback actually correlates against the results that were shown. So similarly, the question comes into place that, because the QR is there and the patients give feedback and all that, but what do the CSAT score says? That means the customer service experience and so on. So we look at that data as a comparative module to look that if actually it affects, it shows a positive correlation as well. And the summary for March 2024 data of 76% response of a sample of 2000 plus. The satisfaction scale actually surpassed our benchmark of 3.7 by average. So most hitting more than 90% on caring, clarity, response, and explanation. So based on the parameters that has been set, getting the feedback from the patients through the QR, getting the feedback from the nurses as well, and also getting from the patient experience shows that overall the project was working well for us, and the improvement that we have put in place over on has been working well. So now the main challenge of sustaining it come into place. But then, as we discussed in our last meeting, we wanted to know directly how do really our patient feel in their own words. So that is one thing that we wanted to measure and look at. But same time, we should not also forget the quality aspect out of it. So we look at patient safety data. And for nursing parameters, we have something called the nursing sensitive indicators. We had something that we measure for pressure sore, phlebitis, medication error, and falls. And we noticed based on these parameters all within the time that we started off this project and latest up to March, we were all within target. I mean, we did not fall off as having an outbreak or, the numbers were out of the scale. So it shows that quality and safety and quality part also has been impacted by this project or program. So like I shared, we have different levels of feedbacks to correlate that how the project was undergoing, and the patient feedback was utmost important. So basically here, actually, I have a short video that was actually taken in one of our flagship hospital in Jakarta, which is Mayapada Hospital, South Jakarta. Allow me to play the video. So the video is actually in Bahasa Indonesia, but we have put in English subtitles for everybody's understanding. So just hold on, allow me to play this. Okay, to sum up basically the two videos, we can see that there is different perspective from patients from what matters to them. Some patients want to be treated with respect and with prompt treatment. And across the spectrum, you have some patients actually feel comfortable with the most small or minor requests, which this program was able to achieve through the feedback. Okay, so basically we have come all this way here. I mean, it's already 1 year down the road. So what is next for us? I think the biggest challenge is actually in place. It's actually when you start a program, I mean, in any quality initiative, we want it to sustain. And I think the same thing actually falls back to us. So for us, our future initiative is actually ongoing initiative in PDCA cycle. And in fact, yesterday, in fact, we had a meeting with all the nursing heads, and this was actually one of the core things that was discussed, that how we want to make this program better. So continuous improvement in patient-centered care, we want to continue to do. And same time, we want to expand to the new entities that the group is going to move forward with. The new hospitals that are going to open, we want it that they as well move forward and also implement this project in place. Same time, as part as action, we want actually to work forward to encourage participation from other healthcare providers. Currently in Indonesia, we stand as the only one, but we are proud to be a part of the 49 countries network that What Matter to You is there. But same time, we would like to encourage the others who are not in to also join as well, and look forward to this platform, especially the monthly meetings, as a place to grow and learn more. So with this continued sharing of experiences, it's a mode, or I would say a process or a journey for us to move forward. So with that, essentially, I sum up my presentation, and I hope that it gives a picture of what we have been doing as part of this project and how far that we have got into it. Okay, with that, I hand back to Anders. Thank you very much, everyone. And I appreciate your time. Same time, I would also like to thank the whole Mayapada Healthcare Group team members for supporting this, and particularly Dr. Dini for actually starting off to initiate this whole project in our team. Yeah. Thank you very much again. I hand to you, Dr. Dini, first before to Anders to add. I can't hear.
Yes, okay. So thank you, Raj,
Okay.
for the presentation. Sorry, I could not unmute myself. So thank you for, for the opportunity and also for the presentations. I know we've been implemented this program for a short while only since last year, but we feel that we give added value to our patients, as well as we give a lot of benefit to our staff, and they feel like they're being more engaged to our patients and their family as well. So with these presentations, if is there anyone who would like to ask questions to Raj and to me as well, we're more than happy to answer for sure. So please, if anyone have any questions or something that we could share further, we will be very happy to do that. So thank you.
I just would like to thank you once again, because this is so wonderful to hear, and it's so inspiring, and it's I see a lot of comments in the chat, and I see, James, you you make a point of how similar challenges we have around the world, and how wonderfully you have approached how to get what matters to you being a part of your whole system in your hospitals, and being a part of the quality improvement efforts we do. I love the way you mentioned PDSA in the same breath as you talk about what matters to you, because I think that makes it so meaningful for all of us who've been a part of the quality improvement movement for several years to hear that. Is there any questions? Anyone who want to ask our friends from Indonesia about something, or just make a comment? I see you stretched for your mic. Maureen, do you want to start?
Sure. Thank you so much. This was fantastic. I am so impressed with how you say, well, we've been doing it for a year. That is such a short period of time to create cultural change. And yet, 1 month after another, you took your actions, and it's really quite impressive. I have 2 questions. One is, has it been a difficult or different path to engage the physicians? The stories that you told really highlighted the impact nursing has had on patient care. And I'm wondering if you need a different path, a different message, or how that's working. And secondly, I'd love to hear, what was the biggest surprise you had last year? I got from the 2 stories of patients that they were asking for not big things, but small things. But what was the biggest surprise you had? And thank you so much.
Okay, I'll just take the questions, Dr. Dini, first, then maybe you can add on. Yeah. So basically, Maureen, first of all, it's a pleasure to see you. I'm capturing you now because there are too many changes, too many people coming and going. Okay. So actually, basically, I'm going to be very blunt here. When we do any program, the most difficult part is actually to get the physicians in. Yeah, that is a truth. They are just too focused being the team leader and directing care directly, that most of the program actually doesn't appeal to them. Sorry to say that. So actually, the whole initiative of our part of doing this through the nurses was actually we are engaging them through the nurses and bringing them a part of the team through the nurses. So basically, the nurses spend the time 24/7 with the patient, and whenever they give the feedback, the same time they also share with the doctors, this thing has happened, and then during the rounds with the doctors, the nurses actually try to ask them if there is anything else the patient wants and so on. So this actually bridge the gaps. It's not a perfect scenario. I mean, there's a lot of work to be done that directly the physician take the lead on this, but we are hoping that we will achieve that, I don't know, maybe someday soon with the help of the nurses. So one day we don't need the nurses prompting them. They will themselves come and tell, hey, the patient needs this. So that is a plan with them. So coming back to the second question, what the most biggest thing that I've seen or feel? Actually, I noticed that no matter what, any countries, when you look at patient care, the one most important thing that actually matters to them is actually only one. They want to be treated with respect. That is the main thing that they look at. I want to be treated as a respect. I want to be treated not as like any other patients or as a customer to your organization, because we are a private entity. They want to be treated as a human being, I would say. So that is actually the core of the whole healthcare system models that we see in the private healthcare setting, what their requirement is. But apart from that, if you look by the side, there have been requests from they want a particular food, they don't want the family to know about particular thing about them, or they want a particular thing, how it's stored in the room. So the request board actually put a lot of information that can be seen that what they want directly. But if you ask me if one thing, like what just summed up earlier, is actually being treated with respect. That's the most biggest thing that they want. I hope I answered you, Maureen.
Oh, both
Dr.
questions perfectly. I so appreciate that. Thank you.
Yeah, Dr. Dean, if you want to add on something, please do. Yeah.
No, I think you have a very good answers. And as part of our appreciations to this program, also how to engage the physicians, we are using our general practitioners. So in each of our award, we have our own general practitioners who also help to bridge the communications between the main physicians and our patients as well. So this is our methods in and also the general practitioners is part of this What Matters to You program as well. But today what we presented is only for the nurse part, because I think that's the most impactful to the patients. But this is our parts to try to engage the patient with the main physician through our general practitioners, because they are very hard to reach. I think it's worldwide problems everywhere. So thank you for a very it's a very good question. So second, Raj, is what make you surprised about this program?
If basically personally that surprised me out of this whole program was, to tell you the truth, the first thing, I didn't know there was such movement until just a year ago. Yeah, that is one big surprise to me. And the second thing is actually the feedback that coming back from the patients. I think this I would say, if personally to me lah, that I would see. Yeah. But when going through more and just looking at the act of act, do and listen, it is actually it makes a lot of sense, I would say. Yeah.
Mm. As for me, I think what surprised me is the correlations between this What Matters to You program with the our nursing sensitive indicators, for examples like falls and all of those things, because we didn't think of measure it, when we start the program, but along the way when we start to measure those things, it shows that it's reducing a lot of things. So it really enhancing our patient safety practice in hospital in terms of patient care. And this is what surprised me the most, because usually it's something that we, or probably me, I read it in many journals, publications, many theories, but now, experiencing to ourselves is it's different level, and also a real eye opener that this kind of engagement could give us a lot of benefit, not only for the communication aspect, but also for the enhancing patient safety and reducing a lot of incidents in our hospital. So this is like the most impressive things for me.
I think well said,
tot-
Dr. Dini. Yeah.
I totally agree. And a lot of people talk about what matters to you as the soft stuff. That's something you care for when you have extra time. And you have made it very clear that this is core business for creating better health care and better health outcomes. So inspiring. We have a question from Angela. She's asking, how did you anchor and engage nursing staff to be completely on board with this program? And I would like to add a second question about the same thing, and that is it a cultural issue here, that it's easier for you to do implementation of initiatives because of your culture, or because in Norway we can do a lot of challenges when it comes to programs and strategies and all that, but when it comes to implementation, it's a very hard follow-up leadership and quality improvement work. And of course it's the same for you, but you hopefully understand the question in the best way.
Yeah. Actually, I have a very interesting answer to this, Anders. This is something that I notice very explicit to Indonesia. Generally, the nurses in Indonesia are actually very accepting. Okay, it's a very cultural thing. Okay, we have a lot of people sharing that Asians, they are known for their soft skills and their behavior and so on. But let me share with you, the mother of that is actually in Indonesia, I would say. So this group of nurses and all that, they once they hear anything, they will always want to try to make it work. That is part of it. And because of that, it actually allows us, or actually enables us to roll out program. But saying so, we also have our own challenges. Like I share, one of the biggest worry is actually if the program die off after some time. So a lot of engagement has been done at multiple levels, from top down and bottom up, and up to actually at certain extent, even during the handovers, we actually participate to see how it's being carried out. Yeah, so up to that level, we are actually looking at this. And as just now during my presentation, I actually shared that we had a discussion yesterday. I just share a glimpse out of it. One of the biggest worry during the discussion session was actually the new hires or the new person who are in the system. They don't carry out this program as how they intended to be, and without monitoring, it dies off. Yeah. So we were looking at engaging at that point. So these are some of the points, or I think values that we look very clear. So overall, generally Indonesians are very accepting, but same time we also have issues. We don't want it to die off the whole program. Yeah. But generally, if you come to Indonesia, you will notice, people, they wish you, they put their hands together. They're very soft-spoken people. They're actually very accepting. Yeah. So
That's
that's why
true.
Bali is well
That's our
known.
culture. That's our culture. But I
Yes.
think the timing was right because last year on 2023, we are starting our transformation program in nursing. So by having this program, What Matters to You, as part of this transformational program, everyone feel engaged because they really want to see the change within the nursing departments in our hospital. So I think this also helps us in achieving a very good result for this program. And hopefully, they will also feel that this is very beneficial to their work and make their work easier than it should be, and also give a lot of beneficial or added value to our patients. And I think they know it by heart by this time. So.
Wonderful. James?
Thank you. I'm James. I'm sitting here in London where there's about to be a big thunderstorm, and it's just wonderful to sit here with 100 people. And I believe there are more who would be in here, except we're limited to 100 on the technology, and to have people from, I reckon, at least 20 across 20 time zones listening to this. And thank you so much. It's absolutely fascinating. If any of us are having a bit of a tough day otherwise, we're going to leave this hour feeling uplifted. So my question is, you mentioned that it's hardest to get the doctors engaged and on board with this, and that probably doesn't surprise many of us here. I speak as by background, at least, a doctor, but I wondered more generally around it. And I agree with Maureen that you've accomplished an unbelievable amount in what is frankly a really short time to get change to happen in healthcare. So I hope you're celebrating that rather than apologizing for it. But I just wondered, what has happened around relationships between staff and perhaps hierarchies and people's sense of being psychologically safe, if you know that term, at work, and the ability to, speak up, speak your mind, which we know has really strong links to all sorts of important things, from patient safety to people, staying in their job rather than leaving it. So it's really just a question about, have you got a sense of wider benefits around team, even though you've been very rightly focused on what matters to patients?
Actually, first of all, James, it's a pleasure to meet you. And I'm sorry about London. It's been a sunny day here today in Indonesia. Okay, that's first part of it. The second part of it, actually, we are on a journey working towards a cultural change of non-blaming culture, having positive reporting, and then making sure that nothing drops out when it's not good, and definitely it's a challenge. That's why we have multi-level workings, like Dr. Dini pointed out. We're working with the nurses to get through the doctors. Same time, we have the GPs we're working with as a mediocre to work with the doctors. And then we measuring indicators. Same time, the group is also expanding. New hospitals are being built. More people are coming in. So this cultural change or building a culture of non-blaming and positive environment of working, it is a challenge, to tell you the truth. It's not easy. And that's why even this year, I think one of the target that we are looking at is actually the number of reporting to have more, the number increase, and having more near misses reported rather than having the total incidents being reported. That is something that we're really looking very critically this year in the nursing and medical department. Dr. Tim will have pointed out that. So again, it's a journey. That's where we are starting from, but it's not going to be an easy one, because Mayapada Healthcare Group is actually moving on a pace that is very, very fast. So we are actually moving forward. And I'm lucky or happy to say that the team has actually supported very well all around. and we are trying to engage so they continue to support each other as well. Yeah.
Thank you.
Mhm.
I
Yeah.
really, yeah, Dr. Dini.
Yeah, so actually this year we're starting another program that we call coordination of care, because I believe that we're lacking of this coordination throughout, hospitalizations. And I hope that by creating this coordination of care, we could engage more doctors and more physicians, especially the main physicians. And also we have another program that we called that really involves so many physicians, for examples like multidisciplinary teams. So the difference between the Asian education for medical college, as you know, compared to the US and to the European education, is we don't do a multidisciplinary team that much. And this is the shifting that we're trying to do to make everyone on board. It's not only the nurse, but also the physicians and also other healthcare professionals that we believe, have this similar, um, you know, impact in patient care. It's not only the physician, but I believe the nursing and other healthcare professionals is having similar impact during the patient care. And yeah, hopefully this is the things that we're going to achieve by the end of this year. But we definitely starting everything from this What Matters to You program, and I really enjoy, working out with the What Matters to You, and I believe this project has, lead to many projects afterwards that we need to follow. For examples like the coordination of care, the multidisciplinary teams, and so many things. It's a very good start for us to see another parts of another parts and another significant role of other healthcare professionals during patient care. So thank you so much, and we really appreciate and enjoy our project.
Really, really, really wonderful. When I listened to you last time and also this time, another system came through my mind, and that is the NUCA system in South Central Foundation in Alaska. And I just wonder, are you familiar with how they work in the NUCA system when it comes to primary health care?
No, we're not.
Yeah,
No.
I'm sorry. Yeah.
Most people haven't heard about it unless they have been to one of the forums for quality improvement in especially in Orlando, United States. But I will send you a link to a presentation they had in London when it's ready. It will be free in the beginning of next week, and I will send you a link to see the CEO and April and Dr. Doug Eby present their NUCA system. I think we'll find it inspiring to see how the primary healthcare system works before and after the hospitalization.
Okay.
So,
Yeah.
And I must say, the storytelling is a very, very strong and powerful tool. And when I heard your stories, saw the two videos, Rajpal, beautiful. And I think sharing that with all the nurses will keep new stories coming. And I've been to a meeting with nurses in a municipality in Norway an hour before this meeting, and we talked about how can we make nurses care for quality improvement and what matters to you when they are so busy in home care. And we talked about storytelling as the really, really core tool to make sure that we keep positive stories coming, to build culture.
Yeah. True.
Okay, we are in the last 5 minutes of this meeting. Are there anyone who wants to stick in a comment or a question? Will you be a part of the What Matters to You Day, the 6th of June, together with us?
I will definitely enjoy that. Yeah. But you guys are having a meetup, right, for that day?
We are not going to have a meeting specifically the 6th of June, because then everyone celebrates and have local arrangements when it comes to what matters to you. We have talked about, since we have so many time zones in this meeting, we have talked about using former Twitter to have messages about what matters to you for the whole 24 hours of 6th of June. So it would be lovely if we could make sure that what matters to you at X can be used for that. But we have a meeting. I'm not completely sure if I remember the day in May, but we have a meeting for, is it the 17th?
Just checking, Anders, 2 ticks.
I actually think it's the Norwegian National Day.
Okay.
It's the 15th of May is the next
15th.
What Matters to You network meeting.
Okay,
And
15th.
it's a Scottish presentation about realistic medicine. So this actually, Dr. Dinny is the Chief Medical Officer in Scotland, engaging with the medical profession in Scotland and calling it realistic medicine. And that's very much focused around changing conversations and enabling focus on the outcomes that matter to people. So it's just a medical way of saying what matters to you. It's a what matters to you movement, which is great to see. So we've had the same problem here as well. How do we engage our medical colleagues in this work? Yeah. So that's May the 17th. Yeah. I just was going to say, Anders, as well. What I like you, I met with Dr. Dinny and Rajpal and the rest of their team a few weeks ago, and it was inspiring and just even better the second time round. So I can recommend watching the recording. If you've even been on this call, you should watch the recording, because it was better second time round. And just the way you systematically have gone about this, engaging senior leaders and the nurse, thinking about if you like, the social movement theory. If we get the nurses on board, the nurses are the channel to getting other people involved, because they're with the patients. So it's just a wonderful example that I think we can all learn from. So thank you very much for sharing. And as James says, we go away feeling uplifted from today. Fantastic.
Absolutely. Yeah, I would also like to thank you warmly from my heart, because this presentation really made the day and the whole week and maybe the whole month inspiring so much. So let's meet again in May, the 17th of May. And you have the What Matters to You World website, where I think Chris has put into the chat a link to how to get to the WMTY.world to see good examples of how What Matters to You have been dealt with in other countries. Definitely a lot of nice tools there. So hopefully that will be of interest. And for me, it's just to say thank you one last time. I hope you have a good sleep after a great presentation, because I know it's late in the evening for you. And to all you others who just have listened muted from Indonesia, we really have to be proud for the way your country has introduced healthcare to this global society online. Really be proud and have a good sleep, all you in Indonesia.
Thank you so much. This was incredible, inspiring, and I look forward to an ongoing relationship forever with us. Thank you.
Okay.
Thank you,
Bye.
Maureen. Appreciate it so
Goodbye,
much.
everyone.
Thank you, Anders, Sean, and everyone. Thank you, Chris.
Very much.
Goodbye.
Thank you.
Thank you.
Goodbye.
Bye-bye.
Goodbye.
Bye, everyone.
Well done, everyone. Thank you.
Thanks.
Thank you, Nurse Laspa.
Yeah, thanks everyone.
Thank you, team.
Thank you, Nasraspa.
Yeah, thank you all.
Thank you, Naraspa.
Thank you, Nas. Thank you, Dr. Dini.
Thank you.
Dr. Denny, thank you.
Thank you, Helena.
Thank you, Pak Raspa. Thank you, Dr. Denny.
Mm. Okay.
Okay. I think excuses. Thank you very much, Anders.
Thank you,
Thank you.
Anders. Thank you, Chris. Thank you,
You
everyone.
really, really made a great presentation. It was great the first time. It was even better this time, and love to hear the stories, the storytelling. Very, very well executed.
Appreciate it. Okay.
Mm.
Allow me to exit. Thank you.
Allow me to exit as well. See you
Absolutely.
soon.
Goodbye. Goodbye. Hope to see you again.
Yes.